In RelyMD, it was started by, and I think it's worth emphasizing, it was started by a group of physicians here practicing locally in the Triangle. That group is called Wake Emergency Physicians Professional Association, so we call ourselves WEPA by that acronym. And we are fortunate enough to have been practicing in this area for 25 years. We have phenomenal partnerships with great hospital systems. We staff 9 different emergency departments. We contract our clinical services with those hospital systems. We staff all 7 of the Wake Med emergency rooms, including the Children's Emergency Department, which is one of the busiest in the state, UNC Johnston Healthcare in Clayton, as well as Granville Medical Center up in Oxford. And last year, we saw a little over 300,000 patients in those emergency departments. So if you have a heart attack or a stroke or get in a bad car wreck, there's a decent chance that we're going to be the ones taking care of you. So why would an independent group of physicians, by all accounts successful and growing, do a startup? And it's one simple answer. It is to simplify healthcare. Healthcare is somewhat complicated at times, inefficient, and then you throw into it things like the ACA and various different policies, it can get complicated. So our goal was to try and bring simplicity to it so that we could bring high quality care to as many people as possible in an efficient, affordable manner. So here's what we're seeing. This is a graph of basically ER visits by time of day. And no surprise, they come at all times of the day and night. So 47% during office hours when primary care physician offices are open, and then 53% of the time afterwards, including the middle of the night. So probably no surprise. What are we seeing in during those visits? So this is a graph of what types of visits actually present to the ER. This is independent data of one large self-insured company in the Triangle. And for the heart attacks and the strokes, which are your level 4 and level 5 visits, that makes up about 75% of the visits. But a good quarter of it is level 1 through 3 visits, which are your coughs, your UTIs, medication refills. That's right, medication refills. Crazy. So again, stuff that can be handled perhaps not in a high acuity setting. And so what does that really mean? Well, as an employer, if you're self-insured, this is unnecessary cost. So, how are we doing this? Well, we are doing it by taking the same doctors and the high level of care and providing them with basically the best technology available. And that technology is accessible these days, affordable these days, so we can now bring that care to you in your home or your workplace, which last check there was no copay, no facility fee. It's a very affordable place to render care. So to reiterate, we can see you with a computer and a webcam, a mobile app, so your smartphone or your tablet, and even just a good old-fashioned phone call, which is the vast minority of our visits. But let's talk about some examples. They solidify some of the concepts. So it's 7 p.m. and little Timmy, who's 4, has a fever and a cough. Mom's very concerned, so they go straight to urgent care. Mr. Smith, he's slicing up some tomatoes and actually gets his finger. It's a gusher, and he's really scared, and he knows it's going to need stitches, so he goes to the emergency department. Maria, she has been dealing with belly pain all day, has a fever, and now but she's very cost conscious. She has a high deductible health plan. She goes to urgent care, who, unfortunately, they're concerned enough about her belly that they're worried about a surgical problem. They send her straight to the ER, which unfortunately results in a double bill. So, again, how are we doing this? Well, we make it as easy as possible for your employees and patients and their dependents to see us. So make an account just like an email account, a password, tell us what's wrong. Our goal is to see you within 10 minutes. Our average wait time is 8 minutes. I'm actually going to make a prediction right here. In the not too distant future, when people are injured or they're sick, they're going to say, hand me the iPad. Of course, I call RelyMD or Dr. Smith first and use my phone. Why? Because the data shows 9 out of 10 times we can handle it in your place where you're at. For that 1 out of 10 that's more serious, well, we know the best place to send you because we're familiar with the healthcare system. So That's a real case, and I'll show that to you in this, as we conclude these examples. So if we're able to alter behavior, and actually people use us and patch in with the RelyMD physician first, little Timmy turns out not very concerning for pneumonia, doesn't appear dehydrated, fine to sit tight, Motrin, Tylenol, push fluids, get rest, see your pediatrician tomorrow. For Mr. Smith, we're able to put up a temporary tourniquet, examine the tendon, make sure there's no nerve injury, you're going to be fine. Actually, it's a straightforward laceration that can be handled at urgent care rather than an ER. And so that's a decent savings there. In addition, Mr. Smith lives in Knightdale. It turns out we know the different facilities in Knightdale, and we can call ahead, let that patient know, let that physician know that this laceration is coming. Same with Maria. Every shift of every day of every shift, we see appendicitis. And so we would recognize that this is a concern for Maria and avoid the urgent care, go straight to the ER. Which ER would you like to go? Well, she would tell us. Once again, we have the backdoor phone numbers to all 180 ERs across the state. We would call ahead, let that physician and charge nurse know that Mrs. Smith is a concerning condition. Cost. So this is very straightforward. For the most part, an ER is an expensive place. On average, it's a little over $1,000 a visit. Urgent care, about $300 to $400. Primary care office, half that. And RelyMD, a fraction of all of those. So now the fun part, the what. So I get to share with you what the patients are saying about RelyMD. And these are true testimonials from just earlier this month. I am truly thankful for this benefit. I have used it twice, once for myself and once for my daughter. So that's what we have found, is that once they get past it, the barrier of using telemedicine, they use it for the first time, they gravitate back towards it. Dr. G, she is very compassionate and professional. I especially appreciate her calling back to see how I was doing. Yes, we do callbacks. I have bragged on this experience to everyone I know, unbeatable. So again, this is sort of how we are spreading, how we are growing. It's not through mass marketing. It's really through testimonials and word of mouth, a very organic sort of spread. Just recently this year, starting in January, we partnered with Biveris, which is another Triangle-based company. They specialize in healthcare surveying with text messaging and by email. So we, on patient satisfaction, would you use this again, yes or no? Since we started it, again, caveat, it's been a month and a half. But would you use this again? 100% have said yes. Would you recommend this to a friend or a coworker? 100% have said yes. Were you satisfied with your provider's care? 97% said yes. So how is this possible? How can these numbers be this real? Well, it's because we only had 2 patients in January. No, I'm just joking. So it is because, I'm letting you know, this confirms what we knew even before the survey data. Uniformly, everyone would rave about what we were providing. And so I'm going to make this, it is the physicians. Again, you know, when you go to a restaurant, you get the best service from the owner of the restaurant. The owners of this company are the doctors. They are committed. They are making sure that everyone has an outstanding customer experience and that their healthcare needs are met. Impact on the patients. So did it save you time in your personal life? 97% said yes. And most importantly, did RelyMD help you get back to work faster? 86% said yes. That is, another way of stating that is, this is helping with absenteeism. This is helping with worker productivity. And what does that mean for employers? It means saved costs. Well, actually, it means improved productivity, efficiency for their company. Medical resolution rate. This is super important. So 94% of the visits that we see, we follow. These surveys come out about 2 to 3 days after we see them. And the reason is we want to make sure that after we see them, they're not all going back to the ER, they're not all going back to urgent care because our care that we rendered was inefficient or subpar. So what we're finding is 94%, they are surveyed and they said, yes, it's handled. We did not have to go and see anyone else afterwards. So 3% had to go see the urgent care afterwards, 3% went to see their regular doctor afterwards, but as you can see, none went back to the emergency department. January 2015, last year, we started without a customer to our name. We didn't have a single client. By the way, Hill, Chess & Woody, who's a sponsor, thank you so much for being our very first client. We really appreciate it. Yep. Our most recent client, Capital Broadcasting, so owners of the Durham Bulls, American Tobacco, WRAL, they launched in January, and we are phenomenally happy about their utilization and their reviews. So again, now we're up to a little over 30 corporate clients, and we're pleased with the progress. And we are very happy to announce our most recent that has not launched yet, but will be launching March 1st. And that's a partnership with UNC Rex Healthcare. RelyMD will be providing the healthcare services for their virtual coworker clinic 24/7. So I wanted to just say thank you so much for allowing me to share RelyMD and our vision with you on where healthcare is headed. Thank you.